Hi, thank you for being here. Today I'll be presenting on how we used NLP for COVID-19 surveillance at the US Department of Veterans Affairs. So I'll start by introducing myself and talking a bit about our problem and how we used NLP to solve it, and then share some of the results. So my name is Alec Chapman. I'm a data scientist based in Salt Lake City, Utah, and I work on a team called BASIC. We are led by Dr. Makoto Jones, an infectious disease physician, and we are primarily an operational team working on biosurveillance and infection control in the Department of Veterans Affairs. So I'll start by saying a bit about public health surveillance. Surveillance is the monitoring of public health events, including infectious diseases. In the context of COVID-19, this mainly means tracking COVID case counts. And for surveillance to be effective, it's really important to have a timely and complete counting of cases. One data source which supports this is the electronic health record, which contains digitized patient medical information from various domains, and the EHR can be leveraged for large-scale analysis and surveillance. This screenshot shows two of the reports generated by the VA for COVID surveillance. These reports show the case counts and trends across the country at VA clinics. And because the VA is a national healthcare system, it puts it in a strategic place to do national surveillance of this kind. So how is this information for surveillance generated? Well, consider a typical COVID-19 surveillance workflow, where a patient comes into a hospital complaining of a cough and a fever. The clinician suspects COVID, and so they order a diagnostic test. This test is performed in a VA lab, and if that test comes back positive, that result is automatically stored in the VA EHR, which can then be used as an automated data stream for reporting and aggregation. However, this doesn't always work. So let's say that a patient, instead of going to the VA, goes to the nearest drive-through testing center. Then that diagnostic test will be performed in a non-VA lab, and any results of that will not be automatically put into the VA EHR. Instead, the patient, when they find out they're positive, might call their provider at the VA and inform them of their status. So these patients who are missing VA lab results, this represents a potential gap in the surveillance counts, which means that the count of cases may be lower than the actual state. So this information, while missing from structured lab data, may instead be found in clinical text notes, like these here, where clinicians record information about their patient's health status. So our objective was to fill this gap. We developed an NLP system to extract potential positive COVID cases from clinical text within the VA. Those cases were then reviewed by clinicians and, if found to be correct, added to VA surveillance counts. And this is deployed as part of an ongoing VA operational response to COVID-19. So our data source was clinical notes from the VA corporate data warehouse, and we processed any clinical text containing these selected keywords. We started looking at notes which were authored starting on January 1st. We implemented our NLP system as a rule-based system. We used Spacey, and part of the reason that we chose that framework is that it allows for a lot of customizations. So we built a number of custom components which are included as part of MedSpacey, which is an in-progress library for clinical NLP tasks. We've released a public version of this system online here at this GitHub repo at the bottom. This diagram shows a high-level summary of what our text processing steps are. So the first component is to identify mentions of COVID-19. This is relatively straightforward. We look for terms like COVID-19, and also synonyms like SARS-CoV-2 and ICD-10 codes. And we allow for some flexibility and variation using pattern matching, so it can catch typos like this one here at the bottom. Once we find those target mentions, we need to do a little extra analysis around them, because clinical text is full of mentions where the concept was not actually experienced by the patient. For example, perhaps it was negated or experienced by someone else. So one method for asserting attributes like this is the context algorithm, which is a simple but effective algorithm that's been used in multiple clinical NLP systems. This visualization shows how the context algorithm works. So given a target concept of COVID-19, it looks for semantic modifiers in the text nearby. So in this sentence, patient was recently diagnosed with COVID-19 pneumonia, diagnosed with acts as a positive modifier to COVID-19. It might also be negated, so your COVID-19 test was negative. It could be uncertain, or experienced by someone else. And this was really common once the pandemic became widespread in the US. So you need to assert all of these attributes so that you can make a judgment as to whether it's actually the patient who is experiencing COVID-19, which is needed for it to be called a positive case. So once you've asserted these attributes, we then use this information to make a document-level classification. We had a fairly simple schema for this, where we said that a document is positive if there's at least one positively asserted mention of COVID-19, meaning that it was asserted to be positive and all those other modifiers were found to be false. And once a document is classified as positive, it was flagged for clinical review. So a team of clinicians used this tool shown on the right to review the NLP results and compare it with any other information in the patient record. And if the clinician judged it to be a valid case, it would be added to the COVID-19 case counts. So I'll now share some results using numbers which were generated ending with June 15th. So this time series shows the amount of data that we processed per week. And you can see that initially on in the year, there was a really low volume of data, 1,000 or 2,000 documents a week containing a word like coronavirus. That really dramatically changed over time, particularly after the WHO declared it to be a full pandemic. So as of June 15th, we've processed 17 million documents belonging to 3.6 million patients. For evaluation of our system, this was a little tricky because we hadn't developed a full reference set because the clinical review was done for operational priorities, not for system evaluation. So we did some estimation of precision and recall. For precision, we reviewed 500 documents which had been classified as positive and calculated the true positive rate there. And for recall, we looked at all known lab-confirmed patients who had at least one positive classified document and considered that to be a true positive. This yielded an estimated precision of 82.4 and an estimated recall of 94.2. And our primary objective was to identify unknown COVID-19 cases. And as of June 15th, this process of NLP and clinical review had identified 6,360 positive cases, which at the time accounted for 36.1% of all known cases in the VA, with the remainder being identified using standardized lab data. So I'll end with a few thoughts and comments. So a pretty significant number of the positive cases in the VA were identified using this process of NLP and clinical review. And these cases wouldn't be included in surveillance counts if it weren't for the ability to look into the text note and extract that information. So NLP really added substantial value to the VA operational surveillance capabilities. We used a rule-based system, and this served us really well in a few ways. So for starters, at the beginning of the pandemic, there was not much of another option because there were no positive cases that could be used for training a classifier. Rules also allow for really quick response and modification, and because the pandemic changes and shifts, we needed to be very agile and be able to react. So for example, the terms COVID-19 and SARS-CoV-2, they weren't announced until weeks after system deployment, but we needed to immediately add and extract them. So our future work will continue working on operational efforts because, as you know, the pandemic continues. We're still processing documents and reviewing cases daily, and the data continues to evolve and shift. One of the immediate next steps we want to do is to evaluate using machine learning. So now we have many positive examples which could be used for training a supervised classifier. There's still a little additional validation and review we need to do, but we do believe that this could augment our system. So I'd like to thank all of the people who put effort into this. This was a very collaborative project, and a lot of effort from a lot of different teams went into this. And here's my contact information, and I'd be happy to answer any questions or chat further. Thank you.